Hello, my presentation is on workplace wellness programs. I will be discussing whether our small office-based accounting company should implement a wellness program to increase employee health, satisfaction, and productivity. And if so, what is the most effective method for our small company to implement a wellness program? Our current workplace environment leads to many challenges in producing and maintaining healthy employees. Our employees often work long hours at stressful yet physically inactive positions which require long periods of time sitting. As well, our workforce is rapidly aging. These factors greatly increase our health care, disability, and employee absence expenses. As we see from the graph, the effects of an unhealthy workplace on employees are very significant. In fact, an unhealthy workplace leads to more than double increase in risk of employees developing various health problems, all of which cost our company money in lost productivity, increased absences, and increased healthcare expenses. Workplace wellness programs have been shown to provide many benefits to the employer. Some of these benefits include increased employee attendance and productivity, improved corporate image, and reduced disability and healthcare costs. Wellness programs have been shown to greatly increase employee attendance and productivity. Studies by the Public Health Agency of Canada found that physically active employees take 27% fewer sick days, and also that companies that had introduced physical activity programs reported employee absences decreased by up to 20%. A workplace wellness program can greatly improve a company's corporate image as well as increasing employee retention and attraction. Employees want to work for companies that treat them well and provide them with a safe and healthy working environment. There are many awards and forms of recognition within the business community for employers who treat their employees well. There are many different options our company could choose to implement into our workplace wellness program. Some of these options are even low cost or free. It is also possible to start a workplace wellness program small and then build the program gradually. A multi-targeted approach is the most effective, targeting different aspects of health and job satisfaction. There are many inexpensive and even free options for wellness programs. For example, we could set up an employee resource center where we would educate employees on existing healthcare resources. For example, both our employee health plan as well as the BC government cover the cost of smoking cessation aids for those employees who wish to quit smoking. However, some of our employees may not know certain information such as this, so we could set up a bulletin board in the staff room or a section of the employee website in which we could outline all the available resources to the employees. Another idea would be to introduce an employee lunchtime walking program where employees that are interested in getting outside and fitness could go for walks during the lunch hour or participate in other healthy activities. As well, many cities provide discounted corporate rates to municipal leisure facilities. So we could look into these options for our employees and make them aware of these programs that are available to them. There are three components to designing a successful wellness program. These are improving the work environment and introducing physical and mental health initiatives. Some work environment improvements our company could look at implementing are improved, more ergonomical chairs or furniture. As it has been shown that sitting causes a lot of health problems, some companies have chosen to switch to standing desks or other alternative forms of furniture. As well, fluorescent lighting has been shown to be very hard on the eyes, so changing to softer lighting could possibly help to improve productivity. And as I mentioned earlier, an employee resource education area where employees can easily access information on employee and healthcare benefit information. Some physical health practices can be incorporated into a wellness program, include improved nutrition, even simple things such as healthier snacks for meetings, smoking and alcohol addiction assistance. Some of it even is available free through different various government associations, so you can just make that information available to employees. Exercise programs or activities. This can be a workplace gym, or it can even just be getting employees out to do walks or involved in charity events such as races or bike rides or what have you. Some emotional health initiatives that we could look into incorporating into our wellness program include stress counseling and stress management programs, work-life balance programs, which could include flexible job sharing arrangements and flexible work-from-home job arrangements. As well, we could look into confidence boosting programs such as Toastmasters or Dale Carnegie. I will now briefly outline the steps involved in building an effective wellness program. The first step is to establish a healthy workplace committee. We will select individual employees from all departments and job functions and all levels of management who are passionate about health and fitness and who want to contribute to a healthier workplace. The next step is to conduct a situational assessment. So we will determine the employer program goals and objectives, and then we will determine the employee expectations from the program, perhaps by doing an employee survey or a series of employee staff meetings in which we will get feedback. Next, we will collect baseline information on employees. So we will measure the absences, maybe some health statistics or factors about the employees, as well as productivity levels and that kind of thing. So then we will have this information available to compare the success of the program against later. And then we will determine the available resources that we have to put towards this project. The next step is to develop a healthy workplace plan. We will decide on what components will be most effective to incorporate into our workplace program, as well as how and when we should implement our program. The next step is to actually put the plan into action. During this step, we want to figure out the best way to make sure our employees are aware of our new workplace wellness program, and we want to try to get as many of our employees participating in the plan as possible. The last step is to periodically monitor, evaluate, and update the program as needed. Track and compare the results to the baseline data that we collected earlier. In doing so, we can evaluate and measure the success of the program and see what impact it has had. As well, we can then decide if we need to make any changes and what we can do to improve the program effectiveness going forward. I hope you have enjoyed my presentation and found it informative. Here are a few resources should you wish to further research the topic.